Change position to supported side lying. Introduction. Sometimes patients will not be able to move on their own. Patients that have had a serious accident or illness that has left them paralyzed or unable to move, such as a stroke, will need to be turned every 2 hours to prevent bed sores. CNAs must know how to change a patient's position if the patient is unable to move on their own. Your testing facility may not have side rails on the bed. Because CNAs can work in a variety of settings, including patients' homes and assisted living facilities where side rails will not be available, the CNA must be familiar with how to reposition a patient safely without the use of side rails. Privacy is important in every skill, but it is very important when performing skills where the patient will be uncovered or undressed. You will be using a privacy blanket to protect the patient's privacy and keep them warm while you perform this skill. When collecting pillows for this skill, take care not to hold them against your uniform. Your uniform is unclean after beginning work, where you lean against patients' beds, touch privacy curtains, etc. Turning a patient onto their side can pose safety risks, as it positions the patient close to the edge of the bed where they may fall. Imagine this patient turning onto his right side. He would then be positioned near the edge of the bed and in danger of falling. For this reason, patients should always be asked to scoot their body toward you and roll away from you toward the center of the bed. This ensures that the patient is always lying on their side in the center of the bed with their back toward you. If a patient is unable to move by himself, there are several options the CNA may use. You may move his body in 3 or 4 sections by placing both of your arms underneath his legs and moving them toward you, then his lower torso, then upper torso, then shoulders and head. You can have a coworker assist you in moving the patient. If you do not feel comfortable moving a patient, you should not attempt to move them alone. Back injuries are common among CNAs, and you should know your own strengths and limitations to prevent back injuries. Many facilities utilize a draw sheet to move immobile patients. This is a flat sheet, folded in half, and placed under the patient's torso and buttocks to help the CNA position the patient. Turning a patient is not difficult with the proper procedures. After covering the patient with a privacy blanket, stand on the side of the bed opposite the way the patient will be turning, and scoot them toward you. Lift their farthest arm upward and cross the closest arm over their chest. Next, flex the knee closest to you and place the foot flat on the bed. Adjust the blanket out of the way and place one hand on the patient's shoulder and one on his hip and turn him away from you. You will be using pillows to keep the patient in this position. One pillow will be positioned behind the back. One will be placed between his legs, making sure it is positioned between both the knees and the ankles to prevent these bony areas from rubbing together and making pressure sores. A pillow will be placed under the upper arm to ensure proper body alignment. And last, the pillow under the head is adjusted so that it is under the head only and not the shoulder. Changing a patient's position every 2 hours and ensuring proper pillow placement will help keep the patient free from bed sores. The patient will be positioned on his back at the start of the skill. You will position the patient on the side indicated in the care plan. Patients are turned from their side to their back and then onto their other side every 2 hours around the clock. Positioning the patient on the proper side will prevent prolonged pressure to one area. The picture on this page shows the common areas of pressure as the patient is lying on their side. It's important to change the position often to prevent any one area from being exposed to prolonged pressure. Watch the instructional video for step-by-step instructions on how this skill is performed, paying close attention to how the patient should be positioned at the end of the skill. Practice this skill to perfect your technique.